ጤና ይስጥልኝ የኢትዮ ዩዝ ቴሌቪዥን አድማጮች እና ተመልካቾች ብርሃኑ አለማየሁ እባላለሁ። በፐብሊክ ሄልዝ ሲያትል ኪንግ ካውንቲ የሄልዝ ኤንድ ኢንቫይሮንመንታል ኢንቨስቲጌተር ወይም ደግሞ በተለመደ አጠራር ሄልዝ ኢንስፔክተር ነኝ። እንግዲህ ዛሬ ከባልደረባዬ ከዊንዲ ጋር የኤፒዲሚዮሎጂ እና ሲዲሲ ኮሚኒካብል ዲዚዝ ነች። እሷም ያው አብረን ፐብሊክ ሄልዝ ነን። በአሁኑ ጊዜ በመሰራጨት ስላለው የሳልሞኔላ አውትብሬክ የምንለው ወይም ወረርሽኝ የሳልሞኔላ ለመነጋገር ነው እንግዲህ ዛሬ የመጣ ነው፣ ከፐብሊክ ሄልዝን ወክለን ማለት ነው። ስለዚህ ቆይታችሁ ከኛ ጋር እንዲሆን እንግዲህ እንጠይቃለን። አመሰግናለሁ።
Thank you. Some of you may remember us here from last year when we talked about an outbreak of salmonella that was linked to eating kitfo. So unfortunately, we're back here again this year. Because we're currently investigating another outbreak of salmonella. So since April this year, we've had a total of 126 cases of salmonella, the majority of which are in King County. Of those, there's close to 20 who are in the Ethiopian community, and this is why we're talking with you again today. Most of those cases in the Ethiopian community, again, ate kitfo. And so we wanted to talk about safe food handling practices so that you can practice these at home and prevent yourself from getting sick.
And as Wendy mentioned, it's really a concern for us when out of 126 cases of the salmonella outbreak, 20 of those cases are from Ethiopian born. So we would like to educate. We'd like to make sure that this incidence, this rate, should be decreased. Sorry, it should be decreased. And why is it happening? We would like to discuss about this traditional raw foods like ጥሬ ስጋ፣ ጥሬ ክትፎ፣ ጎረድ ለብም ቢሆን በደንብ if it's not going to be cooked well, it's called ለብ. So we want to make sure that these foods, these raw or undercooked foods are really risky for an outbreak. So an outbreak would happen if these things are usually mishandled, especially mishandled. So as you all know, the health department, Seattle King County, we try to minimize this foodborne illness in the county in general. About 2 million people. We do inspections and we do education to make sure that the number of foodborne illness are minimized. So that's why when we see this outbreak just going around in about 8 counties, I think.
10 counties now.
10 counties now. So most of them being here in King County. So that's why we are here to discuss about when do people get this kind of illness. What are the foods implicated, and what should people do to minimize this?
So let me talk really quickly about salmonella. Salmonella is a bacteria, and it's one of many germs that can cause food poisoning. Salmonella is usually found in raw meat, especially chicken, poultry, things like that, but it can be found in any raw meat, and it can also be found in produce, so raw fruits and vegetables, which is why it's very important to clean them. You can also find it in pet chickens or pet lizards. You can't see it, you can't smell it. If a food is contaminated with salmonella, you can't tell from tasting it, you can't tell from looking at it, you can't tell from smelling it. The other thing is that even if you've never gotten salmonella before, it doesn't mean you're immune. Some people can get to 80, never have salmonella, and then, eating the same types of food that they've always eaten, bam, they have salmonella.
And like Wendy said, our goal today is to educate the community so that we won't see these cases increasing repeatedly, the salmonella incidents, or for that matter, any kind of foodborne illness, be E. coli and other pathogens. So, as we all know, food is a social kind of thing. People gather for food, especially traditionally Ethiopians. We gather, as Ethiopians, the tradition is you enjoy food, you get together. It's a means of socialization. So when we do that, we can enjoy that, but we have to make sure the food we eat is safe. How would that food be safe? What can we do to make the food safe? I would like to discuss about those. The first thing would be hand washing. We can't emphasize enough as public health officials that hand washing minimizes illness. That's why we have all over in hospitals, you have seen this in health institutions, and we have in Amharic language that shows, as you can see, Jermiak Umu, Enamaihunu. These are educational tools for us to make sure that people wash their hands before they prepare food. Whether it's a restaurant employees has to wash their hands thoroughly for about 20 seconds and then use gloves if they are touching any ready-to-eat food. So hand washing is a key to minimize this foodborne illness that we are talking about. And another thing is cooking. The raw meat, whether it's kutfo or siga or other kind of food, chicken, if it's raw, then it has to be cooked, chicken to 165 degrees Fahrenheit or higher. And if it's beef, 145 degrees or higher, it has to cook so that the bacteria would be killed, minimized, so people immediately eat after cooking. And the other one is to make sure whether a food is cooked. Even at our homes, we have to make sure the food is cooked. We can use, thermometer to make sure the food is cooked. Or traditionally, some people say, "Oh, I can tell whether it's cooked or not by looking," but that may not be the exact way of doing it. So to make sure the foods, the tresiga, and all those meat has to be cooked to be consumed. If people are eating those raw meat, tresiga, and kutfo, tere kutfo, they have to make sure the foods are handled properly. They prepare those kutfo, tere kutfo, and tresiga, and they have to be immediately after they prepare them, they have to put them in the refrigerator. They stay cold at 41 degrees or below, and then they have to be not contaminated, so that if they are contaminated, then bacteria are introduced to that. So when we use cutting boards to cut those meat to make tresiga, which is or tere kutfo, we have to use knife and cutting board to cut it. The cutting board that we use to cut those meat should not be used to cut produce like onion, so that there won't be contamination, so people won't get sick. And the other one is, as public health officials, since we want people to minimize this foodborne outbreak, we do not advise people to eat foods that are uncooked. They have to cook them and eat them. If they decide to eat them raw, then they have to make sure that in restaurants we say they have to have consumer advisory so that people would know they are eating raw food, and there has to be a consumer advisory in there in words saying that if you eat raw food or undercooked food, then it's risky for your health. This is a consumer advisory that has put on the menu, but when it's at home, there's no consumer advisory. So people, especially kids, small kids and elderly people and people who are immunocompromised, their immune system is not strong enough, they get sick. They get sick by eating the food that's mishandled so we want to advise the community to just take cautious in this kind of situation so that we wouldn't continue having this outbreak of salmonella, or maybe next time it could be E. coli and this kind of things. So what else can we...
Well, many people we talk to, they say we eat kitfo, but it's cooked because I pour hot butter over it or I use chili in it. Does that cook it completely?
No. And there may be some people that think that people who are not who don't traditionally eat kitfo, when they see the spice, everything is coming, the kitfo is coming in a bowl or in a tray, they may think that kitfo is cooked. When it comes as tara kitfo, they may not know that it's not cooked, some of them. So that's why this consumer advisory is important. When restaurants give this kind of food which is not cooked, they have to put on the menu that this food, this kitfo, is raw and it's risky for your health. So the education is the key, like we said. So we have to make sure that this kind of raw food products, raw food, since they are risky to the health of the public, we try to encourage, especially the Ethiopian community and other communities. There are other communities that eat raw meat, and I don't think there's raw chicken, but usually that's eaten. But raw meat, then they have to make sure that this kind of thing, these cases will not be too much, so that if they handled it properly, and then it will be minimized. We won't have 20 cases just in one community.
And it's not just at restaurants, it's even preparing it at home. So this time around, we actually saw quite a few cases that didn't eat kitfo at restaurants, they prepared it at home. And one person didn't even eat it. She prepared it for her family, and cross-contamination happened in the kitchen, and she still got sick. And I think what you pointed out is it's very important. The people that are most at risk would be small children, or people with immune systems that aren't completely strong. So people like pregnant women, elderly people, people who are taking any sort of medication that might make their immune system less strong. So it's most important for people with any of these conditions or in any of these groups to be especially careful and understand that foods like kitfo, lub, they are high and they could make you sick.
Yeah. So the key, like we are telling you, the key is to make sure people do not get sick. Food is enjoyment. People enjoy it in a party, in graduation party, in all those. The food that comes has to be safe. Somebody got to be responsible for that food, that it's safe. Like there are some catering, for example, graduation parties when Ethiopian kids graduate, and there's a party that goes on, it's catered. So we have to make sure that as inspectors, we inspect catering businesses. There has to be a license for the catering to be catering business. They have to have a license, a permit from the health department that we go and educate and make sure they have enough equipment so they can give this food to the public. So I think handling food is delicious, food is enjoyment, but if it's mishandled, people get sick.
Yeah.
So that's what we are trying to make sure that the purpose of this thing is to minimize these numbers, so that they won't be out of hand.
Yeah. And let me just talk really quick about salmonella illness. Salmonella, between the time that you eat something that's contaminated and the time you get sick, is between 6 and 72 hours. So a lot of times people think it's the last thing I ate that got me sick, but not necessarily. It could be something you ate a couple days ago. So salmonella, so again, 6 to 72 hours after you eat contaminated food, you'd potentially get diarrhea, bloody diarrhea, and then sometimes fever or nausea or vomiting. Usually it resolves itself, so if you stay hydrated, it'll go away by itself. But some people it can become very, very severe, and people are hospitalized. It can get into your blood, and it can cause big problems. So it's any sort of diarrheal illness. A few things to remember. Number one, if you work in a job, if you're a nurse or a doctor, or you work with food, you need to not work while you're sick. You need to wait at least 24 hours, so one day, until all your symptoms are gone before you go back to work, so you don't get somebody else sick. The thing is that if you have an illness and it's not going away, or you have something like fever or bloody diarrhea, it's very important that you go see your doctor, because they have expertise in this field and they can help you potentially.
True. And when do people know that they are sick? They have foodborne illness. There are some symptoms that they could tell that they are sick because of food. For example, salmonella with this outbreak. What are the symptoms of salmonella? We can mention those, like diarrhea. The person gets diarrhea, vomiting, and also headache, fever, and these symptoms, like Wendy said, stays between 12 and 72 hours. So a person would know that the person got a foodborne illness. So these are the symptoms that we know, that vomiting, for example, especially if it's a lot of vomiting, there could be dehydration that follows, right, which is risky. So they have to seek a medical care. እሺ እንግዲህ አድማጮች አሁን ደግሞ እንግዲህ ያው በአማርኛ ደግሞ እንግዲህ እስካሁን ድረስ የተነጋገርነውን ነገር እንግዲህ ያው የተነጋገርንበት ሰምታችኋል። ምናልባት እንግሊዝኛ በደንብ እንትን ያላዳመጣችሁ ካላችሁ ለማለት ነው። ይሄ አውትብሬክ አሁን የሳልሞኔላ የሚባል ባክቴሪያ ምክንያት የተፈጠረው ወረርሽኝ ነው የሚባለው። እንግዲህ ብዙ ሰዎች ታመዋል። በዚህ በካውንቲያችን 8 ካውንቲ ማለት ነው፣ ኪንግ ካውንቲን ጨምሮ። በብዛት ግን ከሁሉም ካውንቲዎች ኪንግ ካውንቲ ነው የሚበዛው ማለት ነው፣ የኛ ካውንቲ። ስለዚህ ወደ 126 በቁጥር ሆኖ ከ126ቱ 20 በኢትዮጵያውያን የተከሰተ ነው ማለት ነው። ስለዚህ ብዙ ህዝብ ያለዚህ ስለዛ እንዴት ምን እንደሆነ ይሄ ባክቴሪያ ሳልሞኔላ የሚባለው ከምግብ የሚመጣ ምግቡ ደግሞ ጥሬ ከሆነ በደንብ ካልተያዘ ያ ምግብ ኮንታሚኔትድ ሆኗል ማለት ነው። ስለዚህ ያው እሱ ከተበላ በሽታው ይመጣል። በሽታው ደግሞ ከመጣ እንደ ተቅማጥ፣ እንደ ማስታወክ እና የራስ ምታትም ትኩሳትም እነዚህ ነገሮች ስለሚያመጣ ሰው መታመሙን አውቆ ወደ ሕክምና ይሄዳል ማለት ነው። እና ዓላማችን ያው እንግዲህ አሁን የተነጋገርነው ይህንን ቁጥር በየጊዜው ሰው እንዳይታመም ትምህርታዊ መግለጫ ለመስጠት ነው። ምግብ ጥሩ ነው፣ መመገብ ጥሩ ነው። በማህበርም በቤተ ክርስቲያንም በቤትም ግን ምግቡ በደንብ መሆን አለበት። እንዳይታመም ሰው ጥሬ ምንም እንኳን በባህላዊ መንገድ ጥሬ የሚበላ ቢሆንም በጥንቃቄ በንጽህና ተይዞ ቴምፕሬቸሩም የሙቀቱ ሁኔታም ተጠብቆ ከ41 ዲግሪ ፋራናይት በላይ በታች ማለት ነው በታች ሆኖ ቀዝቅዞ በትክክል ደግሞ ሌላ ነገር ሳይነካካ ንጹህ ሆኖ ቢበላ ነው። እንደ ጤና ጥበቃ ፕሮፌሽናሎች ወይም ሰራተኞች ግን እኛ ጥሬ ስጋ ባትበሉ ጥሩ ነው የምንለው። ጥሬ የሆነ ነገር ሁሉም ተቀቅሎ ቢሆን ነው የሚባለው። እንደዚህ በሽታዎች ነፃ ለመሆን ማለት ነው። እና ከዊንዲ ጋር ይህን ነገሮች ነበር እንግዲህ ይህንን ነገር ለማድረግ ደግሞ በተለይ እነዚህ ምግብ የሚሰሩ ሰዎች ማለት ነው ሁል ጊዜ እጃቸውን በደንብ መታጠብ ያስፈልጋል። እዚህ ላይ ሁል ጊዜ በማስታወቂያ ለሬስቶራንቶች እንግዲህ ያላገኙ ካሉ እንሰጣቸዋለን። ያው ይህንን እጅ መታጠብ ከብዙ ነገር ያድናል። ስለዚህ በምግብ ምክንያት ከሚመጣ በሽታ ብዙ ሊያስቀንስ የሚችል በደንብ እጅ መታጠብ ነው ማለት ነው። እና መቀቀል ደግሞ ምግቡን በደንብ ማብሰል ያስፈልጋል። ንክኪት ደግሞ አለማድረግ፣ ስጋና ቲማቲም፣ ስጋና ሰላጣ አለመነካካት ወይም ደግሞ ዶሮ የምንቆርጥበት መቁረጫ አንድ ሆኖ የነዚህ ደግሞ ቲማቲም፣ ሽንኩርት የምናደርግባቸው ደግሞ የተለየ። ስለዚህ እንዳይነካኩ ማለት ነው። የክሮስ ኮንታሚኔሽን እንለዋለን ማለት ነው። እነዚህ ነገሮች ከተደረጉ እነዚህ ብዙ በሽታ ሊታዩም አይችሉም፣ ይቀንሳሉ ለማለት ነው። አመሰግናለሁ።